How you doing?
Hey, how are you? I'm okay.
You're doing okay?
Well,
Last,
trying to come to terms with the new lockdown and all the measures in place, and I'm supportive, but there's a lot to absorb, a lot of changes.
well, let me ask you this, okay? The definition of insanity is doing the same thing over and over again, expecting a different result. For Mississauga, are we not doing the same thing over and over again? Just because right now it does this really affect Mississauga, this lockdown
Well,
or this version of the lockdown?
it does because, as I told you last week, part of the problem was region hopping and people going into other areas. And, think about it. It makes no sense if Toronto, Mississauga, Hamilton are in lockdown. So what happens to Milton, Oakville, and Burlington? Of course, everyone will go there to shop and see their friends. So we're spreading the virus. We all have to be in lockdown region-wide to make that impact. And I think they've done the right thing. And I'm also very pleased at the capacity reductions, right? Because previously you could go to the big box store, and of course there were too many people in the lineup and too many people in the store, and people don't wear masks. And now, as you saw, that's 25% of their capacity limit based on uh, the floor space that is for shoppers, not including their back room, right? And grocery stores and pharmacies, 50%. So at least there's movement there. And I was very pleased to see that. My preference was always to close the non-essential aisle because that's what's fair is fair. But I'm very hopeful now that after 28 days, we can apply these capacity limits to other stores and reopen. I mean, I think we'll have been in lockdown in Mississauga and in Brampton and Toronto for a long period of time. It'll be 2 months, plus being in the red zone for about a week or 10 days, and previous to that, the phase 2.5. So something more needed to be done. And I think we've addressed the main issue for me, which was you can't lock down some areas and not others. And human nature is what it is. People were moving about, and we saw that with that aggregate cell phone data. And that does not mean the government is tracking you, as I saw the comments. It looked like it looked on the data in an aggregate way,
Yeah.
right? So no person, no individuals were ever identified in any way. So I think there are some significant changes, and I really hope this makes an impact. I really do.
Now, the new 28-day lockdown goes into effect on Boxing Day. Do you
Correct.
do you see Peel, Toronto, and pretty much all Southern Ontario opening up at the same time after 28 days?
I hope so. I think that would be the case. They're opening after 14 days in the north, Sudbury North, right? I think that would be the right plan. And then just to put the capacity limitations on small businesses, restaurants, gyms, etc. I mean, I think if we can control capacity on an ongoing basis going forward after we get control of the virus, because that's what we've been saying. The virus is controlling us, it's moving, and perhaps we weren't addressing. I know some of the mayors, I've heard Mayor Brown talk about it too, that we weren't identifying and dealing with the sources of the spread, right? But in Mississauga in particular, it was community spread and it was household spread. So very, very hard to identify. But I have to give kudos to my bylaw. They're out and enforcing, and they're getting calls from 311 on house parties, but house parties of a large nature, so that
Yeah.
your neighbors would notice if there were 10 cars in your driveway and at the foot of your street, and lots of noise, etc. Those egregious violations. And also, they've been noticing another trend, and that's gatherings in commercial units. And they're calling them speakeasies for a better word, but they're gatherings of typically men, with sometimes with shisha, and sometimes there's gaming involved, sometimes there's alcohol involved. And so they're on to that as well. They're on to that, and they're on to very smaller off the grid restaurants that are darkening their windows or covering them with paper and having indoor events as well. So they're on to that. And there have been a number of fines assigned to those types of functions.
This is interesting. So they're finding these, or are people calling in to kind of?
There's a bit of both because they
Okay.
know sort of what the profile of that of kind of event would look like and where they might be. So they are going out and being proactive, but they get calls. I mean, people,
Okay.
particularly Mississauga, everyone wants to do the right thing, and they are, and they're on the honor system, and they know that, and they know there's a couple of bad apples and some bad players that are causing our numbers to grow. So yeah, they're calling people out saying, hey, I'm doing the right thing. You should be doing the right thing too. And kudos to that. I agree completely. You know, we've got the vast majority of our residents doing the right thing and following the guidelines. So of course they're going to call out people who aren't. And it's the right thing to do.
Shisha clubs and cigar clubs.
That's right.
So, how does the Mississauga business community react to
Oh.
this lockdown? What are they saying to you?
Oh, they're devastated. They were so hopeful that they could reopen, even with capacity limitations, is what they were advocating for, in particular the restaurants as well. And, you know, this wider lockdown, just at a time where I thought we might come out of lockdown. I mean, I was very hopeful, you know, if our numbers were being driven down, we could be out of lockdown before the 28 days. You and I have had these conversations
Yeah.
every week, and I was hopeful. But then, unfortunately, what we started to see was the impact on our hospitals. First, we lost the ability to contact trace. Once we're over 300 cases a day, and we're between 450 and 500, we lose the ability to contact trace. And I know we've been redeploying staff who have been laid off because they're parts of Parks and Rec or culture, whether at the city or at the region. There have been other regions, such as Barrie, who have offered to assist us with contact tracing. So that's all great news. But then we saw what was happening in the hospitals. And you know, in our congregate settings, and I just printed up the details from the call last night, because of course, you know, we have these twice weekly calls with our public health and the mayors and our CAOs, and of course we have the GTHA mayors on Mondays, and also we have the emergency response team at the city as well. So 19 long-term care homes, 12 retirement homes, and 4 group homes in yellow risk, which means there's some staff outbreaks.
Okay.
Four long-term care homes, 1 retirement home in red. I believe that one is still Tyndall. Yep, Tyndall has stabilized, so that's very, very good news. But there are a couple others. I won't name them, but there are a couple others that are in red. And when you look at the testing, they're still testing, you know, 800 to 1,000 a day at the hospital, and the positivity rate. So they found it's about 7%. What they found. They have some staff that have been affected. So in the hospitals, almost 100 patients with COVID, and in the ICU, there are almost 30 patients in ICU. So this just means, and they have outbreaks in a couple of units as well, but they're controlling them, and they've taken the action that's necessary. But this just means people who need care in the hospital may not get it in their own community. They may not get it at Trillium. They may have to go elsewhere. And Oakville Trafalgar has been accepting our people. And once they're full, it'll be Burlington and beyond, or it'll be North. And this is true of Toronto hospitals too. When you see that the Toronto hospitals and the Peel hospitals are at capacity and the ICUs are stressed, then people aren't getting the health care they need for ailments other than COVID. And that's a real problem. That's a real problem. If you need, you know, a colonoscopy or endoscopy or whatever you might need, or hip replacement, knee replacement, that all has been scheduled and that may be postponed. So this is the problem, you know, and we hear people saying it all the time. The young people survive this. It's largely the elderly, 80 plus, who are dying. 80% of deaths are among 80 years plus. But nonetheless, we won't get care in the hospitals until we get this under control. So,
Mayor Crombie, what's a tipping point in regards to a number in the 2 hospitals in Mississauga for it to kind of be unmanageable?
right. So they look at capacity limits, right? They tell us each day, each call, what capacity level they're at. And once they're above 90% capacity, it's a real problem. And when you have, what did I say, 28 people in the ICU, that's yeah, 28 people in critical care. That's a significant problem. Last time we spoke, I don't think we had 20. So it's really escalated and it's becoming more severe. But the good news is we started the vaccinations.
I saw that.
Yeah, yesterday. Yesterday was a healthcare nurse from Camilla Care, and you remember that we had a lot of issues with Camilla Care during the first wave, and Trillium Health Partners took over the management, and now it has been released of that obligation. It is in the care of the ownership again. However, so they started there inoculating the nurses. So that is really great news, and I know that the 90,000 came in vaccines, and it's being distributed, of course, across the most critical need areas, which includes Peel and Toronto, and we get our prorated share. So we're very, very pleased, very, very pleased that the vaccinations have started.
When do you think it'll be our turn in Mississauga, Mayor Crombie?
For you and I?
For you and I to get, like, when do you think it'll be mass, vaccination?
I can safely say that the COVID vaccine will be available as openly and freely as a flu vaccine by the fall, by September. So where you and I fit in that, okay. So it'll go by risk of exposure. So of course our frontline healthcare workers, like our nurses who are caring for our elderly, and our frontline healthcare workers at the hospitals. And then it will go by who is the most vulnerable, and clearly by age. Those who are 80 plus or 70 plus will receive the vaccine first, because of course that's where we see the typical terminal cases are among that age group. So of course we want them to get the vaccine next, and it will cascade down in that way. I think I also asked that question. The bucket categories: healthcare workers, vulnerable populations receive the vaccine first. And it's, that's everything we know and assume that would happen. So, you and I may get our turns summer, but everyone who hasn't been vaccinated, certainly by the fall, when it'll be available at their local pharmacy or in their doctor's office, much like the flu vaccine.
Are you going to do it like kind of what Biden did and, get it done? Yeah, so everybody can see that it's safe and,
Well, I don't want to queue jump either, right? So I'm not quite in, I would do that happily. Maybe I'll get Hazel too. I think I suggested that to you, because her being 99 3/4, she certainly qualifies to be on the high priority list, right? Let's take care of her. So if we get her to do it and show that it's safe for everyone, that's what I'm thinking. I'm going to give her a shout and see if she'll do that.
Do it on her birthday.
Or sooner, right? Yeah.
Yeah, or sooner,
sure.
Yeah.
Or sooner, because certainly once they get all the healthcare professionals immunized, then certainly, the age groups, and she would qualify kind of being in the top 1% up there. But I think it'll give a lot of comfort and confidence to people that the vaccine's safe if they see Hazel taking it. I'm speaking out of turn because I haven't consulted her on this, but I just think it's a great idea. I would do it as well, but I'm not quite there yet.
Does Hazel Mccallion have Instagram? Is she watching right now?
I don't think so.
I don't think so either. I'm kidding.
No, I don't think she does. She does respond to her emails and her texts, and she does use her cell phone. I don't think she's on social media though.
Okay. Yeah, and she's not. I've searched. So
I should set up an account for her.
You really should. The question that we get the most, I put out a post in the morning just saying, hey, any questions? Literally about 15 questions were the same one, just asking about holiday gatherings. And they asked different variations of the question. Can 10 people gather? Can two kids play during Christmas? Things like that. Maybe you should just give the official rule for holiday gatherings. And I'll paste this and boost it. And
everybody knows the rules. Everybody knows that it's members of essential, immediate household, only essential supports, right? Those are the rules. You're on the honor system. Are people going to look for ways to kind of bend those rules? I assume they will. My recommendation is be safe. Take the necessary precautions, wear your mask, keep your distance. I would prefer it if you would be virtual with your family, be on a Zoom call, a WebEx call, have a bake-off competition, who made the nicest turkey, and take pictures and show each other and brag and everything else, and do the holiday gift exchange just as we are here today online. Will there be people who will break the rules? There are always people who break the rules. Please be safe. Be safe. Do the right thing. Keep your distance, wear your mask, wash your hands every 5 minutes. You know, it's human nature. It's one of the biggest holidays. We see the spikes, right? Let's be honest. I see the spikes after Thanksgiving. The bigger spike was Halloween. Saw the spike after Diwali. Halloween was bigger. And I'm quite certain we'll see a spike after Christmas as well. Just please, if you're going to bend the rules, be safe and take care of the most vulnerable. Take care of your parents, grandparents, anyone over 70, please. So I'm not condoning it. I don't want people to do it. I'm saying you celebrate with your immediate household. Please celebrate with your immediate household. Do those Zoom calls, WebEx calls. Everybody's doing them. Your mom knows how to do them now too. If you're going to break the rules, please put safeguards in place, please.
Sure. What do you think of Premier Ford's, you know, kind of doing the lockdown after Boxing Day, not right away?
Look, he's in a tough position. He's in a really tough position, and he's balancing all those factors. He took his advice from the medical officers of health. Did they want to extend a few days grace period, as they have been when they did lockdowns in other regions? You know, kind of announced on Thursday, Friday, close on Monday. So they did get a few days to get through, you know, the next couple of days for those regions that are not in lockdown. And frankly, I think that's only ones remaining in the GTA are Halton and Durham, because Hamilton went into lockdown on Monday as well. And Niagara, I think, is still in red. So Niagara, red, Halton, and Durham. Everybody else is in lockdown. So it was really only those three areas that they could make an argument that they're still in good shape. However, I think the Premier knew that for the lockdown to be effective, it had to be right across the region, and he decided right across the province. He's done the right thing. Did he give a few days extra grace period to those regions who, you know, weren't necessarily going to be in lockdown if he hadn't taken the advice of the medical officers of health to lock down the whole province, right? Not just the region. Sure, he gave them a few days extra grace. I don't blame him. I don't blame him. Those are regions that could have made an argument that they didn't deserve to be in lockdown, but he did the right thing to lock them down.
I guess the next couple of weeks, next week, it's going to be holiday time, Christmas time, everybody's going to be getting together. Are bylaw officers going...
Wait, what? No, everybody's not going to be getting together. Stop that. No, stop.
They won't be getting together, okay?
Correct.
Let's be honest.
Well, that's why you asked me to clarify the rules, so I gave you the little proviso, you know?
Okay, so they won't be getting together.
Correct.
But bylaw officers, they're obviously going to be out in full force.
They will be out in full force, and we've actually pumped up their numbers because we do have people who are been laid off from their regular assignments at usually recreational cultural facilities, library, etc., who were eager to be redeployed, and some of them are in bylaw, some of them in security, some of them doing contact tracing. So we are using our own people. So they will be out. They won't be taking holidays. Bylaw enforcement will not be taking a Christmas, New Year's holiday. They will be out. Now, will they randomly knock on your door, Khaled? No. You know, they will be doing inspections. They will continue to do the proactive inspections. I mean, if they drive by and see 100 cars in front of your house, I'm sure they're going to knock on your door, even 10 cars. But largely it'll be following up on calls from 311.
Okay.
Mm-hmm. And continuing those inspections of those commercial units that I told you about earlier, because they've been a little bit successful knowing where to go and where to target.
The secret Shisha club. So
the secret Shisha clubs, and they've been calling them the speakeasies.
The speakeasies. Okay.
Speakeasies, the kind of the gentlemen's clubs where they're gathering to game to play. I guess it's card playing or whatever they're doing. Cards and cigars and shisha and sometimes alcohol.
Okay.
But they're largely in commercial units and sometimes in the smaller restaurants that are off the grid that have the newspaper blocking their windows.
So let's talk about workplace. Have the mayors of the Greater Toronto, sorry, what do you call that again?
GTHA mayors.
Yeah, okay, that's easy enough. Okay,
Yeah.
have you guys made any headway in regards to kind of kind of workers' pay, sick pay, in regards to workplace outbreaks?
So we don't miss an opportunity to ask. With respect to the provincial government, they feel that there is a federal program that could be expanded. So I think that's their way of saying you're looking at the wrong level of government, look to the federal government. And certainly the federal government is looking for opportunities to enhance it, but it's also hard to quantify, right? Like, so, these are precarious workers or people who are on contract that don't always easily qualify for one of the existing programs easily. Right. And we've been hearing from some of the small businesses that to qualify for some of the supports for small businesses, they have to compare their revenue stream today versus their revenue stream last year to prove they qualify for the benefit. And some of our new businesses and may not show, may not have been open last year. So there have been some gaps and some loopholes that need to be addressed and need to be tightened up. But we take every opportunity. We talked about another letter. Of course, we've sent a letter from the Region of Peel, signed in a motion moved by the mayors to ask for the province and the federal government for those supports. And we did receive extra funding. Let's remember what Dr. Lowe had said. We received extra funding. We received extra funding for high priority communities for lead agencies in 6 high need areas in Peel, including Brampton, Southwest Mississauga, East and Northwest Mississauga, and of course, Moulton. And that will be funding for community testing, outreach engagement, wraparound services, and so certainly the testing, enhanced testing. I know we've applied for another isolation center and then the contact tracing, all of that. So we will be receiving additional funding because of course we have high needs areas.
Okay. Yesterday, Doug Ford did say in his press conference too that international travel is leading to a lot of COVID cases coming into Ontario, obviously in Peel because the airport's in Mississauga. What are your thoughts on that? And are a lot of cases coming from international travel that you know of or Dr. Lowe knows of?
Right. No, so not that we're aware of. When we look at our sources of spread, it was small. It was to about 2-3% that were international travel, and we felt that a lot of that had been through logistics, so trucking cargo companies coming back and forth across the border. I think the new concern he's raising is people coming in, the flights that came in from the UK when they identified the new strain there. But the good news is Pfizer feels, or biotech, the company that created the vaccine for Pfizer, that they're confident the vaccine addresses the new strain. So anyways, they're doing more research on it, but hopefully it does. Of course, these viruses always mutate, always do. They're all basically a coronavirus. So was SARS, H1N1, correct? And this is COVID-19, the latest one. And this one's unique and brand new. So it's the novel COVID-19 virus, but they do mutate, and usually the vaccines that have been created will address even the newer strains. So that is something on their radar, and I think that was largely his concern. I don't know that there are a lot of international flights because I think to get on a plane, you pretty much have to be returning home to Canada or an essential worker, and I don't think there are too many of those. I think it's, last time I toured the airport, I will share with you, with the new CEO, Deborah Flint, who's fantastic. And they showed me all the protocols that they have in place to ensure the safety of travelers at the airport. Now, we all know that it is Health Canada and Canadian Border Services that monitor the movement of people in and out, right? So it is not, when people point fingers, the airport, it's actually Health Canada, right? And Canada Border Services that monitor people coming across and re-entering our borders from the airport, and who will screen them going in and coming out.
Now, before we get to the viewers' question, just quickly, this brand new lockdown, Ontario lockdown, what new rules are there for Mississauga and Peel? Is there anything on top that we should are closed or we can't do, or?
There are a couple things. They're pretty discreet. I mean, they're not maybe not be top of mind. So whereas we had drive-ins open and drive-in events, drive-through events, those have been shut down. There are now capacity limits. So in the big boxes, it's 25% capacity on the floor space that your customers would use, not including the back end, right? And at the grocery stores and pharmacies, it's 50% capacity. So those capacity limits. There's some changes to schools. I think will stay closed another week longer, right? In high schools, daycares stay open. I'm just looking. For the most part, we were in lockdown. There's just a few further restrictions with respect to the capacity limits, which isn't a bad precedent, because I hope that when we reopen in 28 days, they'll apply those same capacity limits to all the retailers and all the restaurants too, so that everyone can reopen, but safely. And that's something we had been advocating for, even the big city mayors. I'm looking to see what else. I mean, it's all the typical things you would think of.
Ice rinks still open?
Pardon me?
Ice skating, ice rinks and stuff?
Yes. Skating, yes. Rink skiing, no.
Okay.
Skiing, no. So I guess those folks going up to their chalets can, take advantage of the fresh air and go for hikes, but there'll be no skiing, maybe snowshoeing, cross country. Skating, yes, and you have to book your reservation. We had a little snag. The first weekend we opened Celebration Square. It was mild weather. It was very popular. Everyone came. And of course, that created a problem in the lineup, that there were too many people and people started queue jumping, and there was a little bit of roughness. So security got involved, and now we've just implemented that 1 hour sign up reservation system that we have elsewhere.
Okay. So I'm going to quickly get to these questions from our viewers and I know we have a couple minutes left. Is there a website for online shopping for local businesses during
Yes. Oh, thank you. I hope that was somebody I know set that up. They should look at mississaugamay.ca. mississaugamay.ca, and that's kind of your online shopping experience for Mississauga, right? And you can go there to see all our retailers who are participating, and you could make your purchase, perhaps pick it up curbside or have them deliver it, or buy a gift card. And of course, you've got just a few days left until Christmas Eve, or the New Year, however you celebrate, and go online and support our local businesses, our local retailers, or our local restaurants too. You could always buy a gift certificate from a restaurant. It just helps them get through this second 28-day lockdown period. Please support them. Don't go elsewhere. Support local. And I will advocate for supporting small businesses over the large ones, who have largely benefited because of the advantage they have had of being open when everyone else is closed. So shop local and shop small business.
Good. Another question we have, and this is probably the only non-COVID question, is can bikes ride on the rapid bus lane east to west? I'm curious about that too.
I think some of them are bike lanes. I'm trying to think back. I'm thinking about Dundas, and I think it's a joint bike lane, bus lane. I think the answer to that would be, pardon?
How about that bus lane that is by the 403?
That's not a bus lane, that's the transit way.
Transit way.
No, you cannot ride on that.
I think that's what they're thinking.
It's something we've been proposing, actually, because emergency vehicles can use the transit way. It's our BRT, right? It goes parallel to the 403. So emergency vehicles use it and buses use it, and the uptake now, it's been growing steadily on the transit way, the BRT there. So 18 kilometers of direct route on the transitway. So no, not yet, but I won't rule it out, because I think it's a good idea too. I've just gotten the thumbs down from our transportation folks, but maybe in the future. Okay,
perfect. And there we go. It's 5 o'clock.
Always goes so quickly. Thank you. But remember, Mississauga made. Shop local. protect yourself. I would like to wish everybody a happy holidays, Merry Christmas. I'm Catholic, so we're going to be celebrating Christmas. I'm ordering in from a local place for cater my dinner. Oh, I can't say. You stop that. I get into trouble. I get into trouble. Anyways, I do want to support local, and please do your shopping local. And everyone have a safe and enjoyable holiday. And before you know it, we'll get through this lockdown, and we'll start the reopening process, and our economy will start to recover and grow. So please do the right thing. Be on your best behavior. You're on the honor system. I know people are going to bend the rules. They shouldn't, but if they do, please be safe. Take care of the elderly in particular, please.
Mayor Crombie, thank you so much for being on this show.
Pleasure.
Literally,
we'll see you in a couple of weeks. Is that right? We'll see you in a couple of weeks, and we'll do it again.
Yeah, for sure. Merry Christmas to you and your family.
Thank you. Merry Christmas to everyone. Happy holidays.
Okay,
and happy Hanukkah too. Thank you.